Hello and welcome. My name is Minna El-Turki. I'm the Associate Director for Advocacy with the Global Health Advocacy Incubator. And I'd like to welcome you to our virtual storytelling event, a part of the year-long celebration for the 25th anniversary of the Campaign for Tobacco-Free Kids. The Global Health Advocacy Incubator was founded on the recognition that healthy populations and strong health systems are based on sound health policies. Our mission is to support civil society organizations around the world advocating for policies that reduce death and disease. In 2014, the Campaign for Tobacco-Free Kids established the Global Health Advocacy Incubator with the financial support of Bloomberg Philanthropies. This was to help advocates working to address other urgent public health challenges around the globe and strengthen their own advocacy capacity. Drawing on our decades of experience working with local civil society organizations and governments on tobacco control and other health issues in diverse political systems, the incubator provides strategic support to advocates working to enact and implement evidence-based laws and policies that address other public health challenges. Today, we'll hear from our partners and teams around the world on how they do this life-saving work. But we also want to hear from you. So please feel free to use the chat function to share your thoughts and comments along the way. Also, please consider making a contribution in support of our life-saving work at tfk.org/donate.
An epidemiologist by background and a country coordinator for the Prevent Epidemics program.
It's a fight for sodium reduction.
Is a fight for strong civil eradication system.
In the fight for CRBN reform.
We are in the fight for making everyone healthy.
Now, I'm pleased to introduce Yolanda Richardson and Danny McGoldrick. Yolanda Richardson is the Executive Vice President of Global Programs at the Campaign for Tobacco-Free Kids, where she oversees the Global Tobacco Control Program and the Global Health Advocacy Incubator. Yolanda is a recognized expert on gender and international development, global health, and US philanthropy, with decades of global advocacy experience. Danny McGoldrick is Vice President and oversees global research at the Campaign for Tobacco-Free Kids. With the campaign since its very early days, Danny helped conceptualize and launch the Global Health Advocacy Incubator in 2014. He oversaw its rapid expansion and has provided overall management and strategic direction for the organization, as well as policy advocacy expertise across its programs for the past 8 years. Danny is a seasoned public health advocate with more than 20 years of policy advocacy experience in the US and globally. Yolanda and Danny will tell us about the evolution of the organization from one focused solely on tobacco control in the United States to one now addressing multiple critical public health issues in low and middle income countries around the world.
Thank you, Minna. Hi, everyone. Danny and I are excited to hear our team and partners tell you about the work of the Global Health Advocacy Incubator. but we want to take a few minutes to tell you how we got here. Danny, you've been with the campaign for almost 25 years and were involved in the creation and evolution of the incubator. How did the principles of the Campaign for Tobacco-Free Kids ultimately lead to the creation of the Global Health Advocacy Incubator and taking on the toughest fights beyond tobacco?
Thanks, Yolanda, and hi, everyone. The Campaign for Tobacco-Free Kids was built on an emerging and critical paradigm shift in tobacco control and public health to expand from education campaigns and individual behavior change approaches to a focus on advocacy for evidence-based policy change. The focus on advocacy for policy change is the thread that runs through all of the work of the campaign and is now the cornerstone of our work of the Global Health Advocacy Incubator. No matter the public health issue, evidence-based policy change is necessary to achieve maximum success because of its population-wide effects on behavior, its cost effectiveness, and the change in social norms that results from these policy changes. Ultimately, this work leads to life-saving behavior change.
At the inception, the campaign's approach was to focus on advocacy for policy change. Has CTFK's approach resulted in policy change and reduced smoking among adults and kids?
In a word, yes. Over the last 25 years in the United States, success in enacting policies like tobacco taxes, smoke-free laws, and industry regulation have helped reduce youth smoking by more than 80% and cut adult smoking almost in half. These dramatic impacts on behavior will save untold lives and healthcare dollars in the years to come. But Yolanda, you've also seen this policy change approach play out in our global tobacco and now our GHAI work. How does the policy change approach translate to the global context?
We have seen the positive impact of policy change in our global tobacco efforts as well. We drew on the substantial experience and success of the campaign's efforts in the United States, but of course modified our approach to the global context. We work with local partners to design and execute successful campaigns and have customized our advocacy approach to the local context. Our local teams and partners have a deep understanding of the country, the culture, and the political landscape that is necessary for effective advocacy.
Let's talk a little bit about that big decision to become involved in other public health issues beyond tobacco. What drove that move to the Global Health Advocacy Incubator?
You know, Danny, in many ways, it was a natural evolution of our work to expand beyond tobacco control to other public health issues. But we didn't underestimate the challenge either. We knew that policy change saved lives. We saw the power of policy change in the United States and globally on tobacco. And we felt confident in our advocacy approach with local partners in a variety of countries and in diverse political systems. But importantly, we were fortunate to have the support of Bloomberg Philanthropies, who shared this vision and supported our work.
So as we conceptualized this, what were the assets that the campaign was able to bring to the idea of the Global Health Advocacy Incubator?
Well, we saw the substantial experience in policy reform from tobacco, and we knew that it would translate into other health issues. That experience includes experience in designing and launching a global policy change program, a proven approach to policy advocacy based on a track record of success and lessons learned from hundreds of advocacy campaigns in that program. Staff who are steeped in doing the work in diverse cultures and political systems. And then our network of contacts in civil society and government around the world could inform our efforts on all of these issues.
So how did all these assets help when launching new programs and implementing successful advocacy campaigns on these new issues under the Global Health Advocacy Incubator?
Well, Danny, as you know, we have a structured approach to advocacy. When we're scoping new programs, our local networks help us identify potential local partners, help us understand the political and media landscapes, and begin to develop our plans for working on these issues. Our contacts in government and in the media also inform these efforts, and it's working. The incubator has launched programs on a variety of issues, including road safety, nutrition policy, cardiovascular health, preventing epidemics, drowning prevention, vital statistics, and maternal and reproductive health. We've identified and helped local partners strengthen their advocacy capacity and plan and execute strategic policy change campaigns. These locally led campaigns have produced dozens of life-saving policy wins in low and middle income countries around the globe, spanning Latin America, Africa, Asia, and Eastern Europe. And the policies are already having an impact, reducing sugar drink consumption in South Africa, reducing trans fats in foods in Brazil, and increasing funding for preventing epidemics in Nigeria. We're thrilled that other organizations have also seen our work and seen the impact and started to support our programs. This includes Resolve to Save Lives, Rotary International, and Wildlife Conservation Society.
Wow, Yolanda, thanks for helping summarize 25 years of work in just about 5 minutes. It's clear that advocacy for policy change can and should be a critical element of any effort to improve public health. The Global Health Advocacy Incubator and our many global and local partners have demonstrated this on multiple issues in diverse cultures and political systems, and we look forward to continuing and expanding this life-saving work.
In Tanzania, a woman dies every hour from complications of pregnancy or childbirth, often because she lives far from adequate services. Bloomberg Philanthropies, supported by HNBI Group, stepped in to support the government's vision of providing resources for high-quality maternal and reproductive health care to reach women where they live, even in the most remote areas. In Kigoma region, their focus area, maternal health indicators rose from among the poorest in the country to some of the best. Thanks to advocacy by health workers and the communities they serve, the government committed to maintaining the program, ensuring that this progress can be sustained.
It's my pleasure to be joined now by Ariana Childs-Graham. Ariana is GHAI's Road Safety Program Director. Before coming to GHAI, Ariana collaborated with diverse partners to promote strong primary healthcare systems and universal healthcare coverage with PHC Strategy Group and PHC Initiative at PAI. Ariana, it's great to see you.
Thanks, Mena. It's great to be here with you.
In some ways, my personal journey really mirrors the journey of the organization that Danny and Yolanda described. I started my career at the Campaign for Tobacco-Free Kids as a grants program officer, supporting tobacco control campaigns in South Asia. Now I'm providing strategic guidance on road safety campaigns with the Global Health Advocacy Incubator. I'd be really interested in hearing more about what brought you to GHAI and how well that matches up to the work that you do.
Throughout my career, I continue to be drawn to building and participating in collaborative partnerships, particularly around public health issues. There's something very powerful about civil society advocates coming together around a shared agenda, whether that's at the country level or the global level. And one of the things that drew me to GHAI, aside from working with people like you, is that the way that we value and center the leadership and vision of stakeholders that are driving the progress for policy change. We know that stakeholders are the ones who need to be at the table, shaping the agenda, working with policymakers to create effective, sustainable health systems and healthy environments.
Absolutely. So can you tell us a little bit more about how that works in practice? GHAI's core mission is to support civil society organizations to achieve positive public health outcomes by advocating for evidence-based policies. So can you tell us what that really means?
What that really means is that we help advocates launch successful advocacy campaigns on a diverse range of health issues across many different political systems. That begins with helping civil society organizations to assess and strengthen their capacity to advocate, form coalitions with folks who hold similar objectives, and a range of other kinds of supports.
Thank you, Ariana. This would be the perfect time to hear from one of our partners, Carl Karumba. Carl is a lawyer and civil society leader in the Philippines who was on the front lines of the adoption of a child car seat law in the Philippines in 2019. Carl?
I am Carl Karumba, a road safety advocate from the Philippines. I am part of the team from civil society organizations that push for the successful passage of the child restraints law in our country. The law is another milestone that protects Filipino children from deaths and injuries caused by road crashes. Civil society organizations work collectively in crafting the bill, gathering the evidence backing it, engaging lawmakers to sponsor and enact the measure, building the constituency supporting its passage, mobilizing the experts, and disseminating to the public the importance of having a child restraints law. GHAI strengthened these efforts through the provisions of capacity building for advocates on road safety, policy development, and media engagement, advising campaigners on progressive CRS legislation, encouraging local partners to support each other and help them track their progress. The cooperation between CSOs and GHAI made the campaign for the passage of the CRS law in the Philippines a success, thereby ensuring that current and future Filipino children riding in private vehicles will be safe from deaths and injuries from road crashes. May the Philippine experience inspire other road safety advocates from other countries to push for policies protecting children every time they are on the road. May this be a flame that burns continuously bright, motivating GHAI staff for the years to come to help its partners around the world advocate for road safety laws, thereby saving children's lives, guarantee their safety and well-being, and help them to have a better future.
Thank you, Carl. That's a remarkable success story. For me, coming from GHAI, one of the things that really stood out is that the advocacy capacity of civil society organizations and the strength of the coalition were central to everything else that happened. Ariana, we talk a lot about our strategic approach to advocacy, but that approach is based on strong advocates, right?
Absolutely. They are front and center of all the work that happens, and we work with our partners every step of the way. That means providing strategic support for their policy campaigns, helping to build political support, and mobilizing public demand. We've worked with partners using this approach in more than 40 countries. It includes legal and political mapping, coalition building, media advocacy, and policymaker education, with local organizations in the lead.
Thanks, Ariana. Let's go to another one of our partners, Juan Carlos Morales. Juan Carlos is the director of FION Colombia, a human rights organization that works to guarantee the right to adequate food and nutrition. FION Colombia was one of several organizations that successfully advocated for the adoption of new front-of-package warning labels for ultra-processed products in Colombia. Juan Carlos, can you tell us about the advocacy campaign and why it's important?
Buen día a todos y todas. Espero que se encuentren muy bien. Quisiera agradecerles por esta invitación que se me ha hecho para compartir con ustedes unas muy buenas noticias que ustedes ya saben, pero que quisiéramos de nuevo socializarlas. Colombia acaba de ser testigo de un gran éxito en materia de salud pública, y este ha sido haber logrado una ley de etiquetado frontal que fue aprobada en el Congreso de la República a mediados de este año y fue firmada por el presidente a pesar de la oposición que sectores muy poderosos y la industria tenían a esta iniciativa. Esa ha sido una iniciativa de la sociedad civil. No olvidar que justo este tipo de medidas del etiquetado ha sido recomendado por la comunidad científica internacional, específicamente los organismos internacionales de salud, ya que son medidas que orientan a las personas a tomar mejores decisiones sobre su alimentación y las ayudan a prevenir del consumo de productos comestibles ultraprocesados, que es la denominación técnica a la comida chatarra. Recordar que este tipo de productos no son alimentos. Este logro fue alcanzado gracias al trabajo conjunto de FIAN Colombia, Red Papás de Justicia y el colectivo de abogados José Restrepo, con el apoyo de Global Health Advocacy Incubator. Es una lucha que nos ha llevado varios años y de la cual por fin podemos dar una noticia de victoria. Quisiera compartirles que FIAN Colombia, que hace parte de esta coalición en Colombia, es una organización de derechos humanos que pertenece a la FIAN Internacional. Tenemos carácter consultivo ante el Sistema de Naciones Unidas y nos especializamos en la defensa y promoción del derecho humano a la alimentación y nutrición adecuadas y la soberanía alimentaria, así como derechos conexos. Esto lo hacemos mediante amplias acciones de incidencia social, política, movilización, capacitación, acompañamiento de casos de violación de derechos humanos, entre muchas otras. Durante este proceso que nos llevó a que esta ley fuera aceptada, desde nuestra organización procuramos que se escucharan voces nuevas voces que fueran distintas a las que habitualmente se habían movilizado en las iniciativas anteriores. Me refiero a voces de jóvenes, de académicos y académicas, voces de mujeres y organizaciones feministas, de campesinos y campesinas y de otras personas que habitan en las zonas rurales. Para ello hicimos amplias acciones de capacitación y movilización que fueran dirigidas precisamente a apoyar la incidencia que se estaba haciendo en el Congreso de la República. Obviamente también hicimos mucho trabajo dirigido a los tomadores de decisiones, particularmente a algunos congresistas claves y sus equipos de comunicación. Para lograr eso, llevamos a cabo capacitaciones, talleres orientativos, talleres técnicos, diálogos particulares con cada una de estas personas. Quisiera yo resaltar algo muy importante, y es que cuando hablamos con los congresistas nos enfocamos en dos elementos fundamentales. Primero, hacerles ver que lo que estábamos proponiendo estaba basado en evidencias científicas sin conflicto de interés. Y segundo, que las acciones que estábamos movilizando buscaban precisamente garantizar derechos humanos fundamentales. Esto fue fundamental en nuestra victoria. Insistimos, haber conquistado esta ley ha sido un gran hito para la salud pública y los derechos humanos en Colombia, pero es solo el comienzo. Acá no nos detendremos. Entre otras razones porque vamos a estar muy atentos a cómo va a ser el proceso de implementación de esta ley y aparte de eso, seguir movilizando otras iniciativas de las cuales pues todos y todas estamos comprometidos. Quisiera finalmente decir algo que para mi organización, y estoy convencido para las otras organizaciones que trabajamos en Colombia, es algo muy importante y muy sincero. Es que estamos muy orgullosos de habernos asociado con el Global Health Advocacy Incubator. Las orientaciones que hemos recibido de cada uno y cada una de ustedes han sido fundamentales, han sido fuentes de inspiración, nos han orientado en momentos muy importantes, han sabido escucharnos a nosotras y a nosotras. Por supuesto, eso no hubiera ocurrido si no tuvieran este equipo de trabajo tan magnífico de coordinación en Colombia. Personas que han sabido orientarnos a organizaciones tan distintas para que todos y todas interpretemos una melodía común, lleguemos a un horizonte común y a partir de nuestras particularidades sepamos cómo trabajar en conjunto sin perdernos en el camino. Esa coordinación en Colombia ha sido bastante inspiradora y ha sido bastante importante en este trabajo. Yo quisiera dejarlos por último con un saludo y un agradecimiento por apostar a estas iniciativas de derechos humanos, por creer que, por lo menos en el caso, sabemos que no solamente ocurre acá en Colombia, quienes somos titulares de derechos humanos tenemos derecho a un mejor futuro, a una esperanza. Muchas gracias.
Thank you, Juan Carlos. And now I'd like to welcome Claire Wingfield. Claire is Director of Advocacy and Acting Program Director of the Food Policy Program at GHAI. Claire manages our programs in the Caribbean and South Africa, working with local and global partners to promote evidence-based policies to improve the food environment. Claire has been a global health advocate for more than 20 years.
Nana, thanks so much for having me. It's a pleasure to be here.
It's lovely to have you here. I was speaking earlier with Ariana about the role of advocates, and I wanted to hear from you why you think they're so important.
This is a great question. And I think first it's important to understand that policies based on the best evidence are critical to improving health outcomes. So policies create environments where health choices can be supported, even encouraged, they can be sustained and become norms. And these policies affect health of the entire population. So advocacy, therefore, is critical to ensuring that these policies are passed and implemented. For health policies to be adopted and maintained, they need local champions who let policymakers know that there's public support, but just as importantly, that there's public accountability. And so no one will care more or have a clearer sense of the importance than the people who are impacted by the policy. And that's why we support policy advocacy campaigns that are locally led.
I couldn't agree more on the importance of having the campaign locally led. And I'm also just super proud of all the organizations and partners we work with around the world. And that's in addition to some of our own team members who are also global. I'm wondering if you can talk a little bit about them and the work that they do.
Absolutely. Hands down, working with colleagues around the world is my favorite part of the job, right? Our approach, though, and what's important to remember is our approach to advocacy campaigns is to bring together experts from across a spectrum of disciplines. So from legal, research, communications, capacity strengthening, policymaker engagement. And that means that wherever we work, our in-country coordinators are crucial to a campaign's success because it's them who are leading the charge in terms of bringing together all of the stakeholders from civil society, from academia, from government. And I can't emphasize enough that our approach doesn't work without them, right? I mean, I know you know this. And GHAI's in-country coordinators are the glue of our programs.
Absolutely. I have no idea what we would do without them. Thanks so much, Claire. We're actually about to hear from a member of your team, Rachel Morrison, the advocacy coordinator for the food policy program in the Caribbean. Rachel supports grantees in implementing advocacy campaigns and identifies strategic opportunities for collaboration with global partners. Rachel is a health development specialist with experience working on health-related human rights issues. Rachel?
Thanks, Mena. I am proud to be the in-country coordinator for Jamaica and Barbados in the food policy program at the Global Health Advocacy Incubator. As part of my role as country coordinator, I support our grantees in the implementation of their advocacy campaigns. I also help to identify strategic partnerships with global partners. We have found that it is very important to include in our campaigns strong coalitions with a diverse range of stakeholders. In the Caribbean, we have found that direct advocacy with parliamentarians is what works best. Over the last 2 years, we've made some significant strides in our work. The most important being the implementation of a sugary beverage restriction in schools in Jamaica. Prior to the implementation of this policy, 70% of school-aged children had at least one sugary beverage a day, making this an important step in addressing the issue of childhood obesity.
In Vietnam, 7 children die from drowning every day. With support from Bloomberg Philanthropies, the government's drowning prevention program saves lives by teaching children survival swimming and water safety skills based on proven interventions recommended by the World Health Organization. Based on the program's success, the government committed to expanding the project to reach half of the country's provinces. With the Global Health Advocacy Incubator as the sustainability partner, the program has been designed with a focus on sustainability from the start. The government is incorporating the program into its national commitments and investments, and support has been demonstrated across Vietnam through a quadrupling of local co-funding and leadership that is paving the way for the program's long-term viability.
Now, I have the privilege of introducing Dr. Veronica Irene Schoch. Dr. Schoch is a senior advisor at GHAI and oversees our work on cardiovascular health and prevent epidemics. Before joining GHAI, Dr. Schoch was the National Director of Health Promotion and NCD Control at the Ministry of Health of Argentina. Dr. Schoch also co-founded and served for 10 years as the Executive Director of the Inter-American Heart Foundation Argentina, an NGO working on advocacy and research in non-communicable diseases. Dr. Schoch, welcome.
Thank you so much, Mena. Nice to see you. The pleasure is mine.
It's wonderful to see you too. For the past half hour, we've been hearing about different advocacy successes. Rachel just told us about how civil society organizations are protecting children's health in the Caribbean. So I'd like to take a step back and ask, what does success mean for an advocacy campaign?
It's a great question, and we as a health organization, Campaign for Tobacco-Free Kids and the Global Health Advocacy Incubator promote health policy. So for us, success is a policy path. So this is the first step, but we understand that the complete success is when the policy is implemented. And because our ultimate goal is to save lives. So we need to create that ownership and to build the capacity among the civil society organizations and support the government for the sustainability of the policy after it was passed to be sure that it's going to be fully implemented.
Absolutely. Creating lasting impact is something we have to think about from the start of the campaign. And one of the things we often say in this line of work is advocacy doesn't end when a policy is passed.
Yeah, exactly. And the questions we always have when a policy is passed is who is going to support the government for its enforcement and its implementation? Who is going to educate the population to know their own rights? And how we make the policy sustainable? And if there are resources allocated for some specific policy, how we can be sure that those resources are going to be used in an appropriate way with transparency and to achieve the ultimate goal to improve health services or improve health of the population.
Mm-hmm. And all those questions you mentioned are critical to be asked when shaping these policies and from the start, so that when it is time for it to be implemented, they're actually effective and supportive. But we both know that successful policies can generate a lot of pushback. So can you tell us a little bit about that?
Yes, definitely. That is so important component. When we do advocacy, we work with several components: decision makers advocacy, media advocacy, coalition building, and countering opposition is a key component of the campaign, because we know from our more than 20 years of experience in tobacco control and now in food policy, I am working in cardiovascular health program, improving diet and in some policies like sodium reduction, trans fatty acid, and other food policy areas where we also face a lot of industry interference coming from ultra-processed food industries. So we need to train and to build the capacity among civil society organizations to monitor, expose, and counter that industry interference, to be sure that the policy are going to be free of conflict of interest and based on the best practices. This is also a very important dimension to measure success.
Mm-hmm. Absolutely. Countering opposition is an important component across all our programs, but especially programs that face industry opposition. I know in India recently, there was a policy victory for heart health. Can you tell us a little bit more about this recent development?
Yeah, thank you. We are so proud about the work developed in India and how a coalition of organizations, civil society organizations, supported the government to beat this public health victory, that is the 2% limit for trans fatty acids. in the food. As you know, the trans fatty acids are very harmful for heart and produce heart disease. So India have just achieved the best practices according to the World Health Organization standards. And this happened with a joint effort from civil society and the government in the middle of the COVID-19 pandemic, which is something to highlight because it shows the commitment of the government and the entire society to protect health and NCDs in the context of a pandemic. So we really congratulate all who make it possible.
That's so incredible, especially the point you made about it all happening during a pandemic. One of the organizations behind this success story is Consumer Voice. We have Ashim Sanyal here, Consumer Voice's Chief Operating Officer and Secretary. Ashim, what steps led to these new regulations and where are you going to go from here?
Thank you, Meena. We recently had a huge public health victory in India when Food Safety and Standard Authority of India, or FSSAI, approved strict regulations on elimination of trans fats in food, fats, and oils. This is a very important landmark regulation because trans fat consumption, as we all know, increases the risk of heart diseases in terms of cardiovascular diseases and deaths. The fatalities in India are one of the highest because of the per capita consumption of trans fat, which is very high. The regulatory milestone was the result of strategic advocacy over a period of time. India is in the midst of a public health crisis of non-communicable diseases fueled by influx of ultra-processed foods and ready-to-eat foods. So over the past few years, civil society advocates have helped position trans fat regulation or elimination as a nutrition priority with the FSSAI's Eat Right India movement. Consumer Voice worked with a number of coalition partners to support FSSAI in making the case for trans fat elimination that are in line with WHO recommendations. We organize a number of stakeholder meetings. We organized a roundtable conference. We have provided feedback on draft regulations and very importantly conducted a media campaign over a period of time that generated awareness and support. We also managed to elevate the voices of recognized experts in the medical and the nutritional field. And importantly, members of parliament spoke out in support of the elimination of trans fat. Global Health Advocacy Incubator supported these efforts through strategic guidance on legal research and communication matters. The work is still on in terms of the full regulation taking place on January 1st, 2022 by FSSAI. But in the meantime, glad to inform that FSSAI is working hard to build up capacity for testing trans fat in food, oils, and fats in the states, because ultimately health and food is a state subject. Back to you, Meena.
Thank you, Ashim. Dr. Shokh, before you go, I wanted to ask you more about budget advocacy. Your team recently developed a framework to help political and civil society leaders build support for sustainable investments in epidemic preparedness in their countries. Can you tell us more about this?
Yes, thank you for the question. This is an amazing initiative. We have been working mostly focusing preventing epidemic program in a budget advocacy framework, but it's applicable to many other programs because actually budget advocacy is an important component of many other programs in GHAI. And what is this model? It's a model that focuses not only in the advocacy for the budget increase, the domestic investment to improve health system and the quality of care and reduce health inequalities, for instance, in preventing epidemics, but also to be sure that as part of the advocacy work, the money is going to be adequately spent and in a transparent way. And because the ultimate goal is to improve the health outcomes. So the investment needs to be translated into a better quality of services, in a reduction of the health inequalities, and in the improvement of the health indicators. And also the last step of the budget advocacy model is the sustainability of the resources. I come from the government in my country, and I know how challenging it is not only to get the resources, but then when you have the resources to spend them and to maintain the virtuous cycle of the sustainability of the resources to protect health and improve quality of health system in the medium and long term. So that is the model about. And as I mentioned, it was built mostly from the Preventing Epidemic program, but we took a lot of the experience coming from drowning prevention program, maternity and reproductive health, hypertension programs, and other initiatives in GHAI where health system strengthening is also a very significant component.
Yeah, thank you. It sounds like budget advocacy is very similar to policy advocacy in that it doesn't stop once the budget is there. There's still a lot of work to do.
Exactly.
Thank you so much. This work is so essential to the long-term impact and sustainability. In Nigeria, funding for the Center for Disease Control was doubled over 2 years following civil society budget advocacy supported by GHAI. We're honored to be joined by Dr. Priscilla Ibekwe, Director of Special Duties at the Nigeria Center for Disease Control. Dr. Ibekwe is a public health expert with more than 28 years of experience in health system strengthening, disaster management and recovery, and resource mobilization. Dr. Ibekwe, we'd welcome comments from you on what this budget increase means for Nigeria.
Global health security is everybody's business, and Nigeria takes it very seriously. With global health security, we are as strong as our weakest link. The government of Nigeria is vital in ensuring, the commitment of Nigerian federal government is vital in ensuring the health of all Nigerians. The Nigeria Center for Disease Control was founded in 2011 and received the mandate signed into law in 2018 to protect the health of Nigerians. Consequently, we developed a 5-year strategic plan, which is the NCDC strategic plan, and other plans have been developed as well. The National Action Plan for Health Security, One Health, and several other strategic documents. This is part of our commitment to ensure that we follow and implement the international health regulations. We have used other instruments, including the joint external evaluation to track our progress. So for example, in 2017, we did a baseline. In 2019, we did another midterm review using the external, the joint external evaluations, and we made tremendous progress and continue to address the gaps. We have continued to demonstrate improvement and to engage other national, subnational stakeholders in support of health security. Consequently, Nigeria's NCDC's funding has been increasing to address the high levels of emergency preparedness and response. We are grateful to the federal government of Nigeria and the state governments as well. And we are very grateful to the civil society that has advocated and lent their voice to support the increase for domestic investment in epidemic preparedness, and response. It has really made a great difference. They've helped to host a range of education workshops to raise awareness of health security. They've also lent their voice with the legislation, both at the national and state levels, and hosted a host of other activities to frame, that have framed health security, making it a national priority for Nigeria. We continue, NCDC continues to engage with the ministries of finance and health, both at the national and health level and state level, to ensure that pandemic preparedness is included in strategic plans, and also that we get funding for public health emergencies. We will continue to engage in both internal and external advocacy to ensure we have strong, substantial, sustained national health security funding, and this would also help us to strengthen the global health security. One way that we continue to justify our continued funding is to demonstrate our accountability and show that our funding truly makes a difference. The funding we received from the Basic Healthcare Provision Fund was obviously well used to have state public health emergency centers, have the softwares to provide real-time data, and all this, played out quite well. We're very well utilized during the COVID response. I will continue to do this. Thank you.
Thank you, Dr. Ebekwe. Those are inspiring stories. They're also a good reminder that advocacy doesn't end once policies are passed or budgets are committed. They're also the reason why we do what we do. Everyone has the right to a healthy life, and every community has the right to advocate for the healthier world they envision. Listening to all these stories, it's hard to believe that the Global Health Advocacy Incubator has only been around for 8 years. However, it's not a surprise when you remember that we're building on the 25-year track record of the Campaign for Tobacco-Free Kids. I'd like to thank you for joining us on this journey. We are looking forward to continuing our impactful programs, and we hope that you continue to follow our work. As we close, I want to thank everyone who supports our work, our partners, funders, donors, staff, and board of directors. Our success over the past 25 years is possible because of you. If you'd like to contribute to our work in recognition of our 25th anniversary year, please consider donating at tfk.org/donate. Together, we can create a more equitable, just, and healthier future for all of us. To learn more about GHAI, visit us at advocacyincubator.org and at IncubatorGHAI on Twitter. And please stay tuned for more 25th anniversary events as we continue taking on the toughest fights.